Hello, my name is Sally Majid. I'm the Growth Nurse Specialist here at the Child Growth Foundation, and this is a short presentation explaining multiple pituitary hormone deficiency, MPHD for short. You might also have heard it referred to as panhypopituitarism or hypopituitarism. So what will be covered? We'll be explaining what multiple pituitary hormone deficiency means, what can cause it to happen, and what are some of the symptoms that may indicate a hormone deficiency. We'll be looking at some of the tests that might be carried out to diagnose MPHD, and then how it is treated and who will be supporting families and patients to manage their condition. Then finally, a parent and/or patient will be speaking on what life is like for them with MPHD. The diagram on the right just shows you briefly some of the anatomy affected. In the brain, you can see the hypothalamus and the pituitary gland, and then above the kidneys in the abdomen are the adrenal glands. So it's the endocrine system which is disrupted when someone has multiple pituitary hormone deficiency. But it's both the nervous and endocrine systems that coordinate activities in widely scattered parts of our bodies. They are the major controllers and organisers of the body, and they both act by releasing chemicals to maintain a balance, which is also known as homeostasis. While the nervous system can act on changes from our environment and what is happening within our bodies with speed, the endocrine system sends messages in the bloodstream and produces responses that can take minutes to build up but can last for hours. The hypothalamus is at the base of the brain above the pituitary gland, and it is about the size of an almond. It plays a crucial role in hormone production, and it's considered a link between both systems, both the endocrine and nervous system, and it produces substances that influence the pituitary gland to release hormones. The pituitary gland is below the hypothalamus and is the size of a pea or a bean. It's here that the hormones we'll go on to describe are produced. And there are a number of endocrine glands in the body. The pituitary gland sends hormones through the bloodstream to signal other glands and organs in the body that control metabolism, growth, sexual maturation, reproduction, blood pressure, and many other vital physical functions. So what is MPHD and what causes it? Well, it's a lack of all hormones produced by the pituitary gland, and like I said before, is also known as panhypopituitarism. Hypopituitarism is when you are unable to produce two or more of the pituitary hormones. And causes could be congenital underdevelopment of the pituitary gland. Congenital means you were born with it, it's from birth, and it's an underdeveloped pituitary gland with often no cause can be found. Brain surgery or a head injury or an infection such as meningitis could cause damage to the pituitary gland. Similarly, tumours and treatments such as radiation for those tumours can cause damage to the pituitary gland. And then finally, idiopathic, which means no known cause. It's just arose spontaneously without any reason. So now I'm going to describe the hormones and what a deficiency in those hormones, what the symptoms would be. The diagram on the right is just a quick picture of the pituitary gland, and it shows the anterior pituitary gland and the posterior pituitary gland. That's because the hormones are produced in different areas. These are the ones that on the left are the ones that are produced in the anterior pituitary gland. Growth hormone. So growth hormone, a symptom of a deficiency in growth hormone is small stature, meaning that you're below average height for age and sex. And hypoglycemia is another symptom. That's low blood sugars. And early signs of low blood sugars could be that you are sweaty, shaky, irritated, you might feel dizzy, appear pale, and maybe even have tingling lips. And later signs of low blood sugars are weakness, blurred vision, feel very confused, some unusual behaviour, and possibly even collapse. And then there's the adrenocorticotropic hormone, ACTH. ACTH stimulates the adrenal glands to make cortisol, and that's essential for life to maintain blood pressure and salt and sugar balance, and it's also needed for immune function, and it's very important in helping the body respond to stress. Symptoms might include tiredness, vomiting, and again hypoglycemia. The next one, thyroid stimulating hormone, TSH. TSH stimulates thyroid to make thyroxine, and that controls the rate of metabolism. Again, symptoms could be tiredness, constipation, a lower heart rate, and intolerance to cold. You feel the cold. And then the last one in the anterior pituitary gland is the gonadotrophins, and that's LH and FSH, and they stand for luteinizing hormone and follicle stimulating hormone. And they're needed for physical development at puberty. They stimulate the production of testosterone and estrogen. And symptoms are identified by a delay or absence of puberty. And then from the posterior pituitary gland, there's ADH, that's antidiuretic hormone. And that's essential for water balance in the body, acts on the kidneys to retain water in the body. So symptoms of a deficiency in this hormone might include an increase in frequency and volume of urine. So you might be going to the toilet more often and producing a lot more urine. And then you might become dehydrated, feel tired, and it results in a high level of sodium in the blood. So how is MPHD diagnosed? A number of blood tests will be taken, and then there's another couple of tests that can be done. A stimulation test, which is where your child will be given a drug directly into the vein or the muscle as an injection to stimulate the pituitary gland to produce growth hormone. And then blood tests will be done after you've had the stimulant to measure levels of growth hormone. And similarly with the synactin test, a drug is given to stimulate the adrenal glands to produce cortisol. And then again, blood will be taken to measure cortisol. An MRI scan that takes a closer look at the pituitary gland to detect any abnormalities could be done. And a contrast is a kind of dye that will be injected for the MRI to improve the visibility of the structures. So what are the treatments for MPHD? It's obviously depends on what hormone is affected. If you're deficient in growth hormone, you will need daily growth hormone injections. For cortisol, you would normally have hydrocortisone tablets. But a lack of cortisol can be life-threatening, and individuals should have sick day treatment plans and alerts in place identifying that you are at risk of adrenal crisis. The care plan and specific treatment regimes for various scenarios will be discussed between you and your healthcare professional, as it's essential that everyone caring for your child and everyone around the child is aware that they are at risk of adrenal crisis, because they may need an emergency injection of intramuscular, so an injection straight into the muscle of hydrocortisone if they become very unwell. For the luteinizing hormone and follicle stimulating hormone, boys would need testosterone as either monthly injections, daily tablets or gel, and girls would need estrogen as daily tablets or twice weekly patches. If you're deficient in antidiuretic hormone, you'd be given desmopressin, also known as DDA-VP, as a tablet, nasal spray or drops. And then for thyroid stimulating hormone, you'd need to have thyroxine tablets. Support for managing multiple pituitary hormone deficiency. The endocrinologist is likely taking the lead in managing your child's condition. They may have a nurse specialist working alongside them to support you. Your GP and paediatrician may also be involved in managing your child's care. And of course, us here at the Child Growth Foundation are always happy to help and support you through your journey.
My name is Charlotte and I am 8 years old. I have pituitary stalk interruption syndrome. I take hydrocortisone, thyroxine and growth hormone.
Charlotte was diagnosed when she was 6 months of age after a hypoglycemic seizure. She had an MRI scan showing that her pituitary gland isn't connected at all. So we knew that she'd be multiple pituitary hormone deficient.
I think my biggest worry from the offset really was not knowing what the condition was and what the condition actually meant then and longer term. And off the back of that, then worried really that I might make some kind of mistake in terms of, medication or care plan for Charlotte and not get something right when it really mattered. And then obviously, you start then to think and worry about what's the future actually going to hold for Charlotte then longer term.
I think similar to Dean, I really worried about not knowing the condition very well and making a mistake, particularly not picking up on, signs and symptoms of illness, particularly in those early years where Charlotte couldn't communicate with us that she was feeling poorly. I was really worried that I was going to miss something, and because of that I think I was quite anxious all the time and made quite a few doctor's visits just for reassurance really. I think longer term I worried about what the future held. I didn't like to look too far beyond the next couple of years as it was quite overwhelming, and I worried that would she make it to older years, would she be a teenager, would she make it to adulthood, or would a crisis come and take her away. I also worried about not being there for her. I think that was my biggest fear back then, and it still is now, if something happened and she couldn't get the treatment she needed promptly enough.
I have my thyroxine before breakfast, and then I have 3 doses of my hydrocortisone, and then I have my injection before bed.
And then when Charlotte's sick, we increase the hydrocortisone dose, monitor really closely for any signs of crisis, and then if we need to as well, we will monitor blood sugar levels as well at the same time.
It's really important that everyone who looks after Charlotte is aware of the signs and symptoms of a crisis or illness, so we can catch it early and make sure the hydrocortisone is up to the correct dose. Okay.
I hope in the future that I only take my injection once a month, and maybe when I'm 10 or 20.
And for me, I just hope that it doesn't stop Charlotte doing all the things that she wants to do.
I hope ultimately there's a cure one day, but if there isn't, then I hope Charlotte, when she grows up, has a really good support network to help her when we're not around, and that she can have a completely normal life or have children if she wants to. We've got some tips and advice for people receiving a similar diagnosis. My number one tip would be join the CGF. They've got some fantastic resources and a fantastic support network.
Teach others about our condition to help us.
I would say do as much research as you possibly can to really understand what's going on behind the scenes. It makes it a little bit easier to know what's going on.
Organise everything. Organise your medications, your care plans, make sure you've got everything at easy access to take with you to A&E if you need it.
I would say it's important to let everyone know that it does get easier. It does get easier as time goes on.
And create some fantastic support networks. Make sure friends at school know what's going on. Your friends and family, make sure they're as well educated as they possibly can, because you're really going to need those people in the future.
It's okay to be scared.